Okay, here we go. It's Dr. Marston with the final video lecture of the psychopathology course. And this week we are going to be talking about eating disorders. What I thought would be an interesting place to start is, as we often have started with these lectures, is on the DSM 5 criteria and the definitions of the different eating disorders. And what's kind of interesting, I think, to consider about DSM 5 is the number of different types of disorders that there are. So let's start with the two, I guess we'd say, are the uh, most well known of the eating disorders are anorexia nervosa and uh, and bulimia, which is actually called bulimia nervosa. So um, the symptoms of anorexia, and I know you have DSM-5, so but I just think it's worth going through the criteria and talking about some of these criteria, maybe a little bit about what they say about the definition of eating disorders. Um, so uh, the symptomology for anorexia, restriction of energy intake relative to requirements, leading to a significantly low body weight. So uh, so the it's basically the um, decreased intake of food. It's interesting how they call it energy intake because it could reflect anything that has any sort of nutritional value. So, you know, an example of that would be somebody who maybe doesn't eat solid food, but at least takes supplements. As I've told you a number of times here, a large part of my practice is in medical facilities, and you see a lot of medical facilities. Somebody who will just say they can't eat, um, or they just don't want to eat, or they just don't feel like eating, but they will take protein shakes, or they will take some sort of supplement um, to provide their needed calories. So, energy intake is defined as caloric intake, so some level of calories. Um, the other part of anorexia nervosa, um, intense fear of gaining weight or becoming fat, or persistent behavior that interferes with weight gain. And then, if you go into the third one, disturbance in the way in which one's body weight or shape is experienced, persistent lack of recognition of the seriousness of the current low body weight. So, notice how, of the three symptoms for anorexia nervosa, two of them have to do with more of the psychological aspect, intense fear of gaining weight, and a lack of acknowledgement is basically what you could say. This last one is a lack of acknowledgement of the degree to which low body weight could harm the person or cause severe problems. So there's a real intense focus in anorexia nervosa, not only on um, uh, body weight, but also on actual fear of getting fat, and at the detriment of um, even paying attention to the danger of low body weight. To the degree to which you can see how the person's view of the world is slanted. Being fat becomes the end of the world, catastrophic, whereas being underweight is minimized. And it may even be that the person recognizes intellectually that low body weight is a problem, but they show no signs of actually accepting that as a reality. So that's where the psychological aspect, the cognitive uh, view of the world and how things work comes into play. So the person is intensely focused on not being fat and of downplaying the role that being underweight can play in a person putting their health in danger. A couple things about the specifiers that they list here. Restricting type, um, and it has to be um, the restricting type is where the weight loss is due primarily to dieting and not binging, binging purging. And uh, then there also is a binge eating purging type. So and then there's the severity level based. It's interesting, I think, that the severity level for anorexia nervosa is based exclusively on BMI. So it shows that the real danger as far as anorexia nervosa goes is how much risk the person is putting their health in because of um, their low body weight. By the way, one thing before we move on, I wanted to make sure you saw was that I have included several videos and articles on eating disorders under the materials for this class. So make sure you look at those as well. So that's anorexia nervosa. Now it's interesting. It's interesting to keep in mind that anorexia nervosa has a binging purging type, which means the person has to have episodes of either binge eating and then throwing up, or purging, where there's the self-induced one. Now, then that's often that binging is often what um, is seen as a characteristic of bulimia. So it's interesting to note, which we will here, what the uh, what the formal definition of bulimia is. Bulimia is characterized by episodes of binge eating, um, and so um, and binge eating is defined as um, a definitely larger than average amount of food in a certain period of time, and a feeling of lack of control um, overeating, like they feel they just can't stop during those times. And then recurrent inappropriate compensatory behaviors. This is self induced vomiting or the use of laxatives to sort of um, compensate for how much food they've put into their bodies. And then these episodes of binge eating and purging inappropriate compensatory behaviors occur at least once a week for 3 months. Uh, and then there's also this, that the person is overly influenced by body shape and body weight. Um, so it's interesting to keep in mind that what's really the difference between anorexia nervosa um, and bulimia nervosa. And what's really no is bulimia is the binge eating purging type of anorexia without this period of time where the person just doesn't eat. So bulimia would be where the person overeats and then purges, and as a way of expressing their worry about putting on weight and their concern about body image, as a way of addressing that. But they don't necessarily have the problem with not otherwise eating enough. And you can see that when you look at the specifiers, that the specifiers are mild, same as anorexia, mild, moderate, severe, and extreme. Um, but with anorexia, the severity level is based entirely on uh, the person's BMI, how much they're putting themselves in danger because of having such a low body weight. Whereas with bulimia, the severity is based on how often they have these binging and purging episodes. So how often they have these episodes of eating and then purging. And it's interesting, bulimia, one distinction between bulimia and anorexia is you could have somebody with bulimia who's overweight. That by definition wouldn't happen with anorexia. Anorexia is by the severity level is by definition the person's BMI is below average. So, and I've had that happen a lot with individuals who have bulimia, that they are, despite having these um, overly intense levels of concern regarding body weight, and besides having these episodes of eating, binging, and purging, where the person will eat a lot and throw up and say they're doing it because they're concerned about putting weight, they actually will be overweight. They're or at least have a BMI that indicates that they're overweight. Um, so it just shows a level uh, of difficulty, or a level of difference between the two disorders. Okay, let's go to some of the lesser known ones. And some of these are, like, they're considered, it's interesting to think about how the category of eating disorders is a separate category. And it basically refers to any disorder that has to do with eating, with the internal intake of material. Uh, but um, the some of them are due to clearly psychological, emotional issues, and some of them are ones that are more due to developmental, even intellectual, neurocognitive impact. For instance, pica. Pica is, I see a lot in kids uh, and young and teenagers with intellectual disability or autism, severe autism. Uh, Pica is basically eating inedible material, and you can see up here the criteria: persistent eating of non-nutritive, non-food substances, um, inappropriate to the development level of the individual. So basically, you wouldn't have a 1 or 2 year old diagnosed with pica because 1 or 2 year olds eat things they're not supposed to. Um, and it's also, not a cultural thing that they're eating, that people from a certain, that the culture the individual's from um, allows for and approves of eating certain material. Um, and that it's a behavior. This fourth part's particularly important for what I was just talking about. Um, the behavior is problematic enough that it deserves additional clinical attention, because intellectual disability, the diagnosis itself could allow for making bad decisions about what is appropriate to eat. Autism could also allow for having times where the child may make, or the individual may make, poor decisions about what's appropriate to eat. So a periodic pattern of eating inappropriate things or putting inappropriate things in your mouth, those could all be indicative of just a reflection of autism or intellectual disability. Where I've seen probably that distinction come up as much as is what the individual is eating. So if they're out, a child who has severe autism or intellectual disability is out and they eat grass, it's certainly something the parent wants to stop, but it's not it's not severe enough that it warrants a separate diagnosis. Where I've seen it come up as an issue that does warrant a different diagnosis is when the individual is doing things like eating coins or eating lead. Um, Lead's a big one. Lead paint, pull lead paint off and eat it, um, because of the health concerns or because of the concerns that the individual could choke. Now it's interesting here that in the materials I have, um, when they talk about where pica tends to occur, the most often they mention intellectual disability and autism. They also mention pregnancy. Now, I've never seen it, but apparently, pica does occur, um, not a lot, but with some regularity in certain pregnancies. So there's certainly a lot of indication that this could be due to the hormonal changes that the individual with uh, uh, that the individual has when they're pregnant. Certainly, uh, maybe an extreme sort of extension of the standard thing that pregnant women will often report that they have weird dietary um, uh, desires, dietary uh, uh, desires, because it's even stronger than just a want. They really want certain foods, and it could be that pica is when that goes sort of that. Sometimes there are cases where it kind of goes overboard from being something that the individual wants that may be a strange, the the one is some sort of fish mixed with ice cream. I hear that on TV shows a lot. It's more a joke, but you get these weird combinations that pregnant women often are looking for, and that sometimes with pica, it may be that it sort of goes overboard and goes into the desire for foods that aren't even really edible. So pica, the places where it occurs most often is probably developmental and intellectual disabilities like autism and intellectual disability, and then also in pregnancy. Rumination disorder, or yeah, rumination disorder. I've never seen this. In fact, until I was getting ready for this presentation, I forgot about this diagnosis. It's the repeated regurgitation of food that's not due to a gastrointestinal problem. Um, and uh, so it's the individual just keeps um, throwing up food over a month. And there's some degree, you see this. It's interesting that of the four symptoms, three of them, of the four symptoms listed, three of them could be considered rule out criteria, meaning these are the things that say when it is a rumination, it can't be due to a medical disorder. It can't be due just to anorexia or nervosia or bulimia or something like that. So there are these cases where individuals will purposely throw up food. Now it says on it doesn't, they sometimes they'll swallow it or sometimes they'll spit it out, but there's an on, that there is uh, that it's on purpose that the person is making themselves throw this up. Avoidant persistent food intake disorder. Now, what I think what's interesting about this is actually usually referred to as ARFID, by the initials. Um, and this is where the individual is so avoidant of certain foods, of certain tastes or smells, that they avoid them so much that it starts to impact their health. They lose too much weight. They lose nutrition, uh, and um, that they are so um, that that they just they either lose so much weight or they just start to have severe health problems because of it. Um, so um, it's basically now most of the time, I'm sorry, it's not just that the person doesn't like food because of its smell or taste, but that's often what occurs. But it could be uh, that the individual is just concerned about what it'll mean to eat uh, uh, certain foods, and so it's it's almost like a catch-all category for individuals who just are so severely against eating certain foods that that it impacts on them. One example might be an individual who is so um, distraught by the texture of vegetables that they won't eat any vegetables. I've heard, this is where I probably heard of it the most. People just won't eat vegetables because all vegetables kind of have a certain feel to it. The ones I've heard um, people describe as problematic is that um, all vegetables seem slimy to them, and so they don't want to eat that thing. Now they're also they don't say this on here. I don't think they say it, but it also couldn't be that there's some sort of delusion associated with it. So it has to be that it's that is their interpretation of what it means to eat a certain food, and that it impacts them so much that they just won't eat it, and it leads them uh to avoid um those foods entirely. And then there's binge eating um uh disorder, and of course the thing with binge eating is um is binge eating disorders when you have the binge eating but you don't um have the throwing up periods of time. And binge eating is that again is defined as the person eats a certain amount of food in a certain amount of time that is definitely more than would be average for someone to eat, um, or that they actually experience um, a feeling that they just can't stop eating, and so they just continue eating without feeling like there's anything that they can do to stop. So you see how there's when what I think is interesting about the diagnostic category of eating disorders is there's a wide variety there. Some of them have to do with the type of things the person is eating or the things they are refusing to eat. And then the other aspect of it is the approach that the person takes to eating in general. Um, and there's also sort of this psychological component of some of these disorders, or actually, sometimes it could even be the same disorders. There seems to be, in certain circumstances or in the disorder itself, a sense that the problem is the type of food itself, what the food represents, how it feels, what it causes to the person. On the other end, there are some of these disorders where the main focus seems to be the person's view and interpretation of what eating means, and then connected as eating often means weight gain. Um, and so there's a distinction there between um, uh, eating disorders um, being due to the food, and eating disorders due primarily to the person's fear of putting on weight. Um, and even some of these disorders could be seen as um, the same thing. Um, or no, some of these disorders, both of those issues could play a role, is what I'm saying there. One thing that before I make a statement, I just thought of it and I wanted to make sure that I'm not seeing. Okay, yeah. Um, Bulimia, I mentioned throwing up and the use of laxatives that could be compensatory uh, um, strategies. One other that I didn't specifically mention, but I thought was worth noting is excessive exercising. So that's another. So these are all considered to be compensatory behaviors that are meant to somehow prevent weight gain. What is interesting also about those compensatory behaviors is, for the most part, they won't work. Like a if you eat a gallon of ice cream, and as soon as you finish eating the ice cream, you throw it up. You are throwing up what is left over, but you are not throwing up all the calories. Most of those calories have already gone into your system. And it's interesting how they call it a compensatory strategy and they mention exercising. Well, if you think about when someone binges, how many calories, like I've heard the most recent person that I worked with who had episodes of binge eating would talk about having binge eating where they'd eat 10 candy bars in like a couple hours. Well, not only is that, a huge sugar, that is so many calories that you literally couldn't exercise enough in a day. I don't think you can exercise enough in 24 hours to get rid of the amount of calories you put into your body from eating 10 candy bars. That's a lot of candy bars. And exercise doesn't really, takes a lot of exercise to get rid of a lot of calories. I shouldn't say. I mean, if you exercise like straight for several hours at a time, I mean, high level exercise for 4 or 5 hours, you might burn off the calories you got from 10 candy bars, provided you didn't have any other calories in your body. But it'd be tough. So it's interesting to consider that the compensatory behaviors are really more symbolic than anything else. They aren't really getting rid of the calories the way the person thinks they are. Um, So they're putting the food into their body and throwing up, but on a very practical level, they're not really getting rid of the calories that they just put in there. And people may know that. Um, so it almost seems inevitable to come to the conclusion that the throwing up is more guilt about the binge eating than any sort of actual practical step to get rid of the uh, weight. And it's kind of interesting to keep that in mind too when you consider that anorexia nervosa, which is a disorder based primarily on weight, um, the definition of it is that the person just doesn't eat, because that's the only way to really not gain weight or to lose weight is to just not eat. Now they may also binge and purge, but what they primarily do is not eat and not take in any supplements. That's more, and we started to talk, but that's more on the emotional, psychological makeup of what leads to anorexia nervosa and bulimia, because they both seem to have this sense of being overly concerned about body image. Um, Anorexia comes out in more actual steps, like the person is so um, concerned about body image and looking at that they just don't eat. They do the only thing that would keep them from gaining weight or keep them from being fat, which is they don't eat. Whereas bulimia, there's this attempt to lose the calories that they just put in their bodies, but it's an attempt that in most cases wouldn't actually work. Okay, so let's talk about some more things regarding eating disorders. Um, Now, there is this stat that uh, that I think is useful to keep in mind, and it just shows the extent to which a diagnosis of anorexia or a diagnosis of bulimia or any other eating disorder has to be reflected uh, in terms of um, it being beyond what is typical, because one statistic is over half of teenage girls and over a third of teenage boys do things like skip meals, fasting, vomit, or take laxatives in order to lose weight at some point. So that approach is not uncommon. And it's also not uncommon for preteens and teens, both boys and girls, to be uh, to be worried about being fat and to express that as being a serious source of anxiety for them. Um, what are some of the things to look for as far as an individual developing anorexia? Rapid loss of weight. Um, this is from a physiological point of view. This is important because if someone just don't eat, that's the 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 weight loss will become noticeable. And if it's noticeable that you think it occurred relatively um, quickly, then there wouldn't be a whole lot of explanation if the person didn't have a medical problem, a new onset medical problem. There wouldn't be an explanation besides that the person just isn't eating. Change in eating habits, withdrawal from friends or social gatherings, uh, extreme concern about appearance and diet, um, and then another one is hair loss. Can be a sign of anorexia. Um, Tends to occur in early 20s to mid 20s, although lately the average age seems to have increased to with there being more, not the majority, but more and more cases of individuals in the 30s and 40s having evidence of anorexia. Um, and then bulimia. Um, the warning signs the counselors look for as far as indicating if bulimia might be happening would be um, some of the avoidance of social gatherings, intense focus on dieting. You would also look for evidence. One of the things that comes up the most with bulimia is that purging tends to leave physical. Throwing up tends to leave physical. If you throw up too much, you're going to have physical signs, staining of the teeth, get discoloration of the teeth. Um, One interesting thing is that the person starts to develop calluses on the back of the hands um, and knuckles, and that would be because the way people primarily um, self-induce vomiting is to put their fingers down their throats. Well, when you put your fingers down your throat, I can't put your finger down your throat. These parts, your knuckles and back of hand, are going up. So you're pushing down here, and this part is coming up against your front teeth. So basically, a person who self-induces vomiting a lot is basically pushing the back of their hand and even their knuckle up against their teeth for long periods of time. So that's going to start to damage that area after a while. Unusual swelling of the cheeks and jaw area, again, having to do with it's interesting to keep in mind when you're thinking about self-induced vomiting is that vomiting puts a lot of pressure on the body. And so, the swelling of the cheeks and jaw area is something that can happen if you're vomiting on a pretty regular basis. Overly uh, overly intense focus on exercise can be another one. Bulimia um, tends to occur a little bit earlier. Um, Anorexia tends to be in the early to mid 20s. Bulimia could start as early as 16. Um, some developmental part of it, staying away from eating involves a lot of self control, and teenagers are not known for self control. So it could be that you see this in large part because teenagers are more likely to want to rely on uh, the sort of quick response to try to deal with their eating issues, and that would be the self-induced vomiting. Um, there is some research to also suggest that the self-induced vomiting, not only, I said before, maybe more symbolic as opposed to practical, but also because the purging, the heavy eating, is a way of getting the person to sort of prepare to throw up. It's hard to throw up if you don't have anything in your body, but if you have a lot in your body, it's relatively easy to throw up. Um, and so that sort of like um, quick uh, way of um, getting food out of your body and getting calories out of your body might be something that a teenager is more likely to do. And it's almost that you can almost see that when anorexia comes along, it's at a slightly older age where the person may, because they're older, have a more practical or realistic understanding of what it actually is going to take to lose weight. And so they don't eat because they know that's really the only way to actually lose weight. Um, where I'm going with that is what just basically makes uh, anorexia and bulimia, the distinction, interesting. Or one thing that makes it interesting is anorexia, as much as they are both severe problems, anorexia actually involves the steps that it would take to actually lose weight, which is to just not eat. Whereas bulimia involves a behavior that probably sounds like it would make you lose weight, but it actually doesn't. Uh, Onset of bulimia and anorexia is usually associated with some sort of stressful life event. Physical abuse and sexual abuse are two major ones, and family problems are two. Two other ones that are particularly associated with eating disorders is leaving home for college and termination of an intimate relationship. Um, so those are two that tend to particularly um, be associated with the onset of anorexia and bulimia. Some personality traits that tend to be associated with the development of eating disorders like anorexia and blood. By the way, I should say that I realize that as I'm going on here, I had talked before about how eating disorders, that there's a range of them. The pica and the rumination and the anorexia and bulimia. I'm kind of focusing here just on anorexia and bulimia. The other ones are more, I think, in the category of uh, uh, acute stress conditions or intellectual developmental problems. So we could talk about them more in class if you want, but I'm focusing more on anorexia and bulimia here. Some personality traits that tend to be associated with eating disorders like anorexia and bulimia: low self esteem, feelings of inadequacy, person feeling like they lack control over their life, fear of becoming fat, lonely. Uh, Individuals who develop eating disorders tend to be individuals who rarely disobey. They also tend to be perfectionists, and they also tend to keep their feelings to themselves. Um, uh, they tend to be achievement oriented, so they will often be good students, excellent athletes, and looking for competitive careers. Not that those knows that not all of those traits are bad. And lonely is bad, fear of becoming fat is bad, but not all of them are bad. Achievement oriented is not bad, but it can become so intense that it becomes a problem. uh some other aspects of these personality traits that can enter into why they contribute to developing eating disorder. Food and the control of food is used as an attempt to cope with feelings and emotions that seem overwhelming. So basically, the person doesn't feel like they can control their emotions and how they're dealing with their emotions. So they try to control their weight and what happens to their body. Um, Individuals who develop eating disorders also can be individuals who have not really learned to cope with problems on their own because they have more often tended to follow the wishes and demands of other people. Uh, Individuals who develop eating disorders may develop binging, and purging behaviors as a way of reducing stress and anxiety in their lives. Individuals with anorexia often thrive on having control of their bodies and gaining approval from others. The typical way you hear this explained with anorexia is the person goes through a period of time where they're getting praised for losing weight. Oh, you look so good. You look like you took off some weight. And then that just keeps going until they're in a dangerous um, area. And anorexia also uh, eating disorders also tend to be associated with individuals who give an extremely high value to external reinforcement and acceptance. Um, some things about the genetics as they're associated with anorexia. Uh, First degree biological relatives of people who have this disorder tend to be at a higher risk for anorexia. Um, uh, Twin studies have shown that identical twins tend to have a significantly higher risk factor for anorexia than non identical twins. Mothers who put a strong emphasis on their daughter's weight and physical attractiveness may cause those individuals to have increased risk of developing eating disorders. And Girls with eating disorders often have male figures in their life who are overly critical of their weight. It is interesting to keep in mind that of even though I said before that males and females tend to be anxious about being fat, 90% of the individuals who develop bulimia and anorexia are female. So that these are issues that can significantly impact on males and females, but when it tends to go into a situation where the individual meets all the criteria of an eating disorder, most of the time it tends to be women. Men deal with those issues in different ways according to the statistics. Environmental factors. Uh, it's interesting. Environmental and interpersonal factors that can contribute to anorexia. Very often, it's a person who has difficulty expressing emotions and feelings, but also, as you might expect, it tends to be individuals who have at some point in their life been teased or ridiculed because of their weight, or just really had it pounded into them that they can't, that they have to look a certain way. So uh, those are the environmental and uh, interpersonal factors that contribute. Tends to be individuals who have a lot of problems expressing emotions and a lot of history of being teased and ridiculed because of the weight, or otherwise told that being fat is just totally unacceptable. Okay, I left quite a lot of videos, and there's a video, there's a recording from a podcast, and are two articles for you to read. So I'll cut this a little short because you're going to have a lot of other material to look at. And we'll pick this up at the class on Thursday. I'll see you then.